History Spotlight, brought to you by HEC Media and the Missouri Historical Society.
Hello, I'm Dr. Jody Sowell, president of the Missouri Historical Society in St. Louis, and this is History Spotlight. World AIDS Day serves as a reminder of the ongoing HIV/AIDS pandemic and the historical impact it has had on St. Louis. Assistant Curator of LGBTQIA Collections, Darnell, explains that while the history is marked by loss, it also showcases inspiring community responses.
December 1st is World AIDS Day. Observed annually since 1988, it's a time to raise awareness about the ongoing HIV/AIDS pandemic and to remember those lost to the disease. It's also a perfect time to reflect on the history of AIDS in the St. Louis area, a history that we can trace back more than 50 years. The history of AIDS in St. Louis is full of loss and sadness, but it's also filled with inspiring stories of community members coming together to support one another and to push for change. Before we go on, let's review some key terms. HIV stands for Human Immunodeficiency Virus. Among other means of transmission, HIV can be spread through unprotected sex, by using contaminated needles or syringes, or from mother to child during pregnancy. If HIV infection is untreated, it can lead to AIDS, which stands for Acquired Immunodeficiency Syndrome. AIDS is a disease that attacks the immune system, impairing the body's ability to fight off other infections. Today, medicines are available to keep most people with HIV from developing AIDS, allowing them to live long and healthy lives. These medicines also prevent people with HIV from spreading the infection to others. But prior to the development of effective treatments in the mid to late 1990s, having HIV was often a death sentence. The HIV pandemic was one of the greatest public health crises of the 20th century. In St. Louis City and County alone, nearly 2,000 people died and thousands more were infected in the 1980s and 1990s. Everyone is susceptible to HIV, regardless of sexual orientation or other social factors. But in the United States, it has had a disproportionate and devastating impact on the LGBTQ community, specifically men and transgender women who have sex with men. HIV also disproportionately impacts African Americans, people living in poverty, and other marginalized social groups. Most scientists believe that HIV originated in Central Africa in or around the early 20th century. The virus quietly spread across the world, escaping the notice of the medical establishment for decades. Many people are surprised to learn that the earliest known person in the United States to die of AIDS-related complications was a St. Louisan. In 1969, a teenager named Robert Rayford died of a mysterious illness at Deaconess Hospital. 18 years later, scientists testing a preserved tissue sample discovered that Rayford had had HIV and died of complications from AIDS. It is unknown how Rayford contracted HIV, and his sexual orientation is also unknown. But Rayford's story shows that HIV was present in St. Louis a half-century ago. It also shows that the virus was circulating long before the 1980s and far from the big coastal cities that are often remembered as the starting point of the pandemic in the United States. The disease we now call AIDS first came to the public's attention in 1981, following reports of a strange illness affecting gay men. In the following years, the numbers of those affected by AIDS rose rapidly across the country. In St. Louis, as in other cities, community members organized to meet the needs of those living with HIV and to help reduce the spread of the virus. They forged an array of grassroots AIDS service organizations. One of these AIDS service organizations was St. Louis Effort for AIDS, or EFA. Founded in 1985, EFA's many projects included a buddy program, which paired individuals with AIDS with supportive community volunteers who provided practical and emotional support. EFA also launched St. Louis's chapter of Pets Are Wonderful Support, or PAWS. Still active today, PAWS helps people with HIV keep their dogs or cats when they are too sick to care for them on their own. Food Outreach was another local AIDS service organization that got its start in these years. It provided nutritional support to people with AIDS, who often had special dietary needs due to their medications and struggled to cook for themselves because of their health. Food outreach remains in operation today and has since expanded its mission to include assisting people living with cancer. Unable to work as their illness progressed, some people with AIDS faced homelessness. Founded in 1988 by a coalition of local faith groups, Doorways responded to this need by helping people in difficult circumstances obtain comfortable and dignified places to live. Today, Doorways continues its mission of providing affordable housing to people living with HIV. Meanwhile, in 1989, St. Louis activists founded Blacks Assisting Blacks Against AIDS, or BABA. This group was organized to address the particular impact of the AIDS crisis on the Black community. BABA engaged in education, prevention, and advocacy efforts. As a fundraiser and community-building activity, BABA held its first B-Boy Blues Festival in 1995. The event has since evolved into St. Louis's annual Black Pride Festival, an important occasion for the region's African American LGBTQ community to gather in solidarity and joy. EFA, Food Outreach, Doorways, and BABA are just some of the many organizations that emerged in the region in the 1980s in response to the AIDS crisis. Other groups work to support those living with HIV, to educate the community about the disease, and to remember those lost to AIDS. Another local group was ACT UP St. Louis. In the early 1990s, this organization engaged in nonviolent civil disobedience to demand a more urgent and equitable government response to the crisis. ACT UP members organized confrontational, headline-grabbing protests to draw attention to the life or death stakes of the disease. In the 2020s, HIV infection is for most people a manageable health condition and not the death sentence it once was. But the HIV pandemic remains a serious public health concern in the St. Louis area. Today, activists and health professionals here continue to work to prevent the spread of HIV and to make sure those living with the virus receive the support and medical care that they need. Their efforts build on a foundation laid by community-powered responses to the AIDS crisis in previous decades.
To learn more about the Missouri Historical Society, visit mohistory.org.